So we will continue from this lecture, this slide, which is about the drugs used in GIT, that is constipation. So here we have dietary fibers as a treatment option for constipation. Examples: psyllium, methyl cellulose. Mechanism of action: these drugs are polysaccharides, polymer. They are polymer of polysaccharide which are not absorbed into the body. They stay in the GIT and get excreted, and they form the gel when they come in contact with water in intestine and distend the intestine, so stimulating peristaltic movement. They mainly act in the colon. That's why the action take 1 to 2 days to work, and the laxative effect is not very strong, it's just mild. So you can see here these are cellulose or any other dietary fiber like psyllium. They absorb the water, become bulk and stimulate peristaltic movement in this way, forward peristaltic movement. Adverse effects are very few, like flatulence, like allergic reaction. Contraindications include: if someone has spasm of intestine or ulcer, should not be given, and any condition which involves systemic retention of sodium, because the psyllium and methyl cellulose, they already contain sodium. Clinical uses: mainly to treat constipation, but sometimes useful to treat mild chronic diarrhea in a patient with IBS, because in diarrhea there is a lot of water going, because these dietary fiber, they absorb water, so they might be a useful option in mild chronic diarrhea. Osmotic laxatives, which decrease the constipation by osmotic action. So osmotic laxatives, two types: one is salt, another one is carbohydrate. Salt, we have salt of magnesium or salt of phosphorus salt. They are poorly absorbed and hold water. They hold water in the intestine by osmotic forces. So that's why the intestine become bigger, distend, and peristaltic movement stimulated. Defecation occurs after 1 hour of administration. They mainly act in the small intestine, that's why action is faster. And the intensity of effect depends on the dose. If the dose is normal, then laxative effect and bowel evacuation occurs 6 to 8 hours. If doses are high, cathartic high doses, then fast action 1 to 3 hours. And coming to the main contraindication, renal insufficiency. If these magnesium and phosphate salts are given in renal problem, it may cause magnesium toxicity or hyperphosphatemia. Other osmotic laxative include carbohydrate like sorbitol and lactulose are non-absorbable sugar, but they are hydrolyzed in the colon to organic acid, which act as osmotic laxative, but they act in the colon. These act in the small intestine and take 1 to 2 days work. Laxative effect is mild, small. Coming to the stimulant laxatives, example: Cascara senna, bisacodyl and castor. Cascara senna, they are natural product obtained from the plant, contain anthraquinone glycosides. Okay, they are not absorbed into the blood, but they are hydrolyzed in the colon by the bacteria, and they inhibit water and electrolyte absorption and stimulate colon motility. Because they must reach colon, effect also is slower. Bisacodyl, which is mainly administered, it's a synthetic, not a natural from plant source. Bisacodyl is administered in the form of suppository. It causes the stimulation of rectal mucosa and defecation within minutes, very fast action. Castor oil, the triglyceride of racinoleic acid is hydrolyzed in the duodenum and become rhenolic acid in the intestine, castor oil. This racinoleic acid stimulate fluid and electrolyte, intestinal smooth muscle, and this act mainly in the small intestine, and action fluid evacuation occurs after 1 to 3 hours. Adverse effect colic pain, dehydration with electrolyte. The drug may be useful for emptying the bowel in some poisoning cases, because castor oil is a very strong laxative, or to eliminate some parasites in the intestine. That's why this is not commonly used laxative. Castor oil is not commonly used, it's only used in special cases like poisoning or some parasite. Fecal softeners, these are the drugs which make the feces soft, or also called as emollient laxative, available as a jelly tablet. Docusate sodium, it's a surfactant, it's a surface active compound which act in the GIT in the manner similar like detergent and produces the effect and feces become soft. They are weak stimulant laxative. Fecal softener, mineral oil is indigestible, it is not absorbed or digested and cannot penetrate in the body and make the feces soft. It should not be used regularly. This mineral oil should not be used regularly because it interferes with the absorption of fat soluble substances and cause foreign body reaction in intestinal mucosa. So, it interferes with the absorption of fat soluble vitamins, vitamin A, D, E, K, etc. That is why it should not be used on regular basis. So, this was about the remaining slides of GI drugs.